Good afternoon. My name is Dr. John Henning, Mayor of Morrow Bay, and I wanted to give the community an update on COVID-19 related issues with regard to not only our community, but also the whole county. As of today, if you have been following the numbers, there are 2,093 cases in the county of San Luis Obispo. 1,716 people have recovered, fortunately. There are 340 people at home recuperating. 20 are now hospitalized, and there are 7 patients in the intensive care unit out of those 20 that have been hospitalized. And sadly and unfortunately, there have been 15 deaths in San Luis Obispo County, and our hearts go out to the families and family members of those who have passed due to COVID-19. As you may know, the caseload in San Luis Obispo County has risen rather dramatically over the last several months. The state at present has implemented a waiver program, and if a county meets the criteria that they've established for waivers, the county can begin to open up. Initially, San Luis Obispo County met the state waiver, but about 5 or 6 weeks ago, they fell out with regard to a single criteria, and that is the number of cases per 100,000 population over a 14-day period. That's why we had to go backwards as a county due to the failure of meeting that metric. And many of the businesses that were open had to close again and or partially close and move to outside either sales, especially in the food and beverage industry. In April, to go back, there were about 104 new cases in San Luis Obispo County. And again, today, here we are in August the 7th, there are 2,093 cases. If there's any good news, the death rate in San Luis Obispo County is one of the lowest in the country. The death rate of all COVID cases is less than 0.5%. For California, it's just above 2.1%, and nationally, the death rate is about 4.5%. So we're trending very low with regard to the number of deaths, but unfortunately, we have had 15 deaths. The majority of cases in our county are in the age group of 16 to 64. The large proportion of the individuals that have passed due to COVID in our county were an average age of 83 with 2 to 4 comorbid conditions or secondary major health conditions. The community in our county with the largest number of cases is Paso Robles with 554. I'm not going to go down and read the list. You can find that information on readyslo.org. That's READYSLO.org. There is a tremendous amount of information about every community in terms of the number of cases, the death rate, the number of individuals hospitalized, all of the state guidance, all of the county guidance, everything you ever wanted to know about COVID-19 is there. I will tell you that Morrow Bay has gone from 6 cases in March. As of today, we have a total of 27 cases. Fortunately, we remain as a community or city on the very low end of the total number of cases in the county. Nipomo has 272, San Luis Obispo 261, Arroyo Grande 155 cases, etc. So you can see, fortunately, Morro Bay continues to trend very low with regard to number of cases. The county has increased the number of tests they have been doing. As you know, a week ago, probably through public information and press conferences, the county announced it would be doing 3 clinics in Morro Bay. That was last Monday, Tuesday, and Wednesday. And if you go to readyslo.org, on a daily basis in one or more communities throughout the county, they are doing active testing through the county. And so if you do need to get tested or would like to be tested because you think you're symptomatic or have been exposed, please feel free to come to one of those clinics. And again, I won't give you the extensive list, but that's on readyslow.org website. The unfortunate thing with testing, and I'm going to be honest with the community as always, is the turnaround time, not only locally but nationally, has been very long. The average turnaround time from the time a test is done until the results are known are about 6 to 8 days. Which means that if you think you're sick or ill, you should quarantine yourself before those test results come back, because they may well have been positive, but again, it may take 6 to 8 days to get the results for those tests. And that's a problem that the county is working on with regard to not only private labs, but county labs to improve that test turnaround time. The city of Morro Bay has a COVID-19 page. If you go to Google and Google in City of Morro Bay, and you'll pull up the city website, right on the front, you'll find our COVID-19 information page. It is full of information, not only containing state, federal, local, and as well as many other guidelines. You'll also find all of the state orders there, all of the local ordinances that apply to Morro Bay, and basically anything you ever wanted to know about COVID-19 is there as well. We also have a number of assistance programs that you can look for on that website. The Morrow Bay Cares program, if you need assistance in obtaining groceries, if you're not able to get out, if you need food, if you need help with getting to doctor's visits or medication, you can click on that link, make a call, and we can arrange to help you through that program. In addition, the Are You OK program continues to be provided. If you need to be checked on a daily basis, if you're living alone or isolated, you can get a daily phone call from our fire department to check on you to make sure that you're okay. And again, there are a number of other opportunities there as well. I did want to point out here, be a hero and wear a face mask. Morro Bay has implemented the Be a Hero face mask program, or Be a Mask Hero. I'm wearing my button. I have my mask available at all times in my pocket. And we have put signage out throughout the county, the city, and we're asking folks to wear masks if you're outside, especially if you are unable to socially distance. That is extremely important. I want to thank our city staff of essential workers that continue to provide services to the city. Unfortunately, our offices remain closed because of the COVID-19 situation, but I'm very proud of our police force, our fire department, our harbor department. They have been putting in so much extra time and effort in monitoring the situation. As you know, we've had a large influx of tourists come into the community from outside areas. And I'm going to tell you now, the city of Morro Bay is not actively advertising for people to come to this community. In fact, on the contrary, we've suggested that people stay home. The reason is, if you look at the information and data, the majority of folks, and we love people to come to Morro Bay, except during the pandemic, but the majority of folks come from the Central Valley. And right now, the numbers of cases in the Central Valley have skyrocketed, and there are concerns about outbreaks there. And so our messaging is, please, stay at home. Certainly if you're symptomatic or you've been diagnosed with COVID, now is not the time to travel to Morro Bay. Lastly, what can you do as a citizen of Morro Bay? Ladies and gentlemen, let me tell you that it is absolutely imperative that when you leave your home, that you wear a mask. A face mask covering can protect others from asymptomatic carriers, people who may have COVID that don't know that they have it because they have no symptoms. You are protecting others from potentially getting the disease. One of the things I've heard about in the community is seeing people who have come here possibly from the outside that do not wear masks. What should you do in that situation? Do not confront them. Do not be aggressive towards letting them know they should be wearing a mask. If you have concerns, please call our police department or our code enforcement department, and those numbers are readily available on our website. But do not confront folks directly. So number one, wear your mask if you're going to be outside. Number two, maintain strict adherence to social distancing. It's imperative. Stay 6 feet apart, especially when you're in an area where you're going to be with people that you don't know. 3, avoid crowds. Crowds are not something that you want to be in right now, because in crowded places, especially inside of a building, that's when the spread can be significant. And number 4, wash your hands frequently. 20 seconds with soap and water, or if you're using hand sanitizer, rub those hands for 20 seconds. That will help sterilize and clean your hands. The last thing I will say is, if you are concerned that you may have COVID, you are in a high-risk group, please stay home. Now is not the time to go outside if you're in those high-risk groups. COVID is around us. It will be for some time, but protect yourselves and others, especially yourself, by staying home during those times. Be a hero and wear a face mask. Thank you. Be well and be safe.